Good afternoon, everyone. Thanks for being with us on a Thursday afternoon. Hope all is well out there. We wanted to spend a little bit of time this afternoon talking you through a couple of things, but first, thanks for being with us. We know everything is stressful out there. I do know that there's new information regarding COVID-19 and cases rising, so I know there's some concerns out there, but we still wanted to spend some time with you today, going over some items and giving you some updates. I am actually doing this from my office, and with me I have
Tiffany Junkins, Manager of Children's Services.
And Tom is here, as he has been through our webinars, and he will be assisting us with technical as we move forward. So again, thank you for being here, and let's go ahead and dive into the slides. So we've got an agenda for you. The update on reopening childcare, and again, I'm just gonna slide into that one really quickly, but again, I just wanted you to be able to see that there are some topics, licensing policy, and then we're gonna end with fiscal updates, so we'll go over information as we go forward. So thank you, everyone. Let's go ahead and move forward. Let's go ahead, Tom, next slide. So I'm gonna move directly in to licensing policy, and I can't spell on a Thursday, it should say policy update, didn't catch that one. But you received in our CSD update, the updated licensing policy. As we had talked about before, when the one that came out a couple of months ago, it had an end date of 150 days. And so there has been a new policy update. We did send it out to you. I'm hoping that you will do as we always ask, is that you review it so that you can make sure that you are abreast of any changes. One of the things I will say is that there are a couple of things that are in there that are the same as before, that if you get a positive COVID-19, you are responsible for making reports. Your licensing rep will need to know, and also you need to report to CDPH. And I thank you, because I know those of you who have had them have done exactly what has been identified and have been following the process. CDPH, as you know, we have given you the information. There is a document that you need to complete, and there are questions that you need to answer. Also, what we've asked you to do is give that information to the supervisor of your team, who will then make sure that we have it here at DFSS. So again, thank you for the reporting. Don't like the fact that we're having positive cases, but we do know that COVID-19 is still within our community, and we are still in this health crisis today. So again, reporting is in the new update. One of the other additional updates that I want to draw your attention to, and one of the things that people have been asking about, is when will we be able to increase our group sizes for our 3 to 5 year olds. I will say in the licensing update, it does say that you can now go with your 3 to 5 programs, you can increase to 17. It had said 10, then there was a 12 possibility, and now we're saying 17. And so, but again, I bring you back to, that's if your licensing rep has worked with you, you've worked with your licensing rep, you've been following the guidelines, you've been following the enhanced cleaning, you've been doing all the things that you need to do, then increasing your group size is the next phase of what you're able to do. One of the other pieces that is in there, and I want to draw this attention because I have had people who are questioning and asking questions about what they might be able to do in their programs. The one thing that you must do is you must keep your groups constant. You cannot transfer children between groups. You cannot start on one end of the day with a few children, adding children during the day. I know, as we've done, and I've talked about it before, and how we operate our programs, but that is one of the things that is not okay under licensing policy, the previous and this one. The reason for that, as you all know, keeping those groups constant means that you're mitigating the risk of transference. Also, if there is something that occurs, meaning a child, family, staff actually comes down with a positive COVID-19, then you have restricted the number of individuals who've come in contact with that child or family. And then what you will be doing is making some determinants about what you need to do as a result of that. By moving children throughout your program, you are risking having to close an entire program versus what might be only one classroom. So again, if you have questions about it, that's why we're here. Let me know, and we can talk it through. But again, in this policy update that came out on the 19th, which we did give you the update in the CSD update, we are saying that you must keep your groups in constant grouping, meaning even when they're going out on playgrounds, when they are doing activities, all the things that you do, you need to keep those same children and staff together throughout the day. Again, any questions, as always, don't hesitate, let us know. Next slide.
All right, so now we're going to get into the ISBE and CPS data fields. As you guys know, since consolidation in 2018, we've made plenty of modifications to the COPA system. So I just wanted to kind of go into some of that and what that looks like. But first, I wanted to start with PFA and PI eligibility. So to be eligible for ECBG funding, PFA and PI, the child does have to be age eligible and also income eligible. Income eligible is capped at 200% federal poverty level. And the child, the family also must live in Chicago. I want to put an emphasis on that because, you know, we have had some children, you know, Cicero kind of bordering and this, that, and the other. You have to live in Chicago. And this is important. You can't enroll a child in a PFA PI program unless they live in Chicago. That's an eligibility requirement. PFA teachers, you have to have a minimum of a early childhood education gateway level 5. Of course, the Pell is what you need, but we'll take the minimum of an ECE gateway level 5. And it's mandatory that each PFA teacher that's assigned to a PFA classroom, it's important that we have their IEIN number, which is the Illinois Educators Identification Number, that has to be entered into the COPA system. There's no ifs, ands, or buts. We can't get around it. We're not able to count the classrooms. We're not able to count the children if they're not tied to a qualified teacher. The other thing I wanted to mention, because we've gotten a lot of questions about the home language survey. So the home language survey is something that there's some mandatory fields in there, and this is important. One of the questions under the home language survey section is it asks about, does the student speak a language other than English? That's a yes or no question. Either they do or they don't. The next question is a language other than English spoken at home? There's a lot of languages to choose from. It's a drop-down feature. Go ahead and take a look at that. Pick the appropriate language that applies, if any. The next question is the home language survey date. That date is needed. We need to know when it happened. We don't want to guess. We need your help with making sure that you complete this field. That's very important as we do report this information to our funder. Student level data. So there's some data that in large volumes that we've been getting that have been missing. And so I just wanted to go ahead and call your attention to it when it comes to race, ethnicity, pre-IPT scores, and also address. I put address on here because it's not that we're not getting address. Sometimes addresses could be incomplete. Sometimes they could be wrong. Or sometimes they can live outside of the city of Chicago, which everybody should understand. Not eligible then for PFA or PI if they live outside of Chicago. So student level data is important. We are drilling down. We are expected to report to our funders on a monthly basis. I need your help. Make sure that you're in constant communication with your team who enters data, who's responsible for entering that data into COPA, because I need their help, which means I need your help. Thank you.
Next slide. Thanks, Tom. So as an update, and we all know with our federal grant, there are different times that we are engaging in reviews. We had FA2 in 2018, April of 2018. We have just received notification this week on Focus Area 1 monitoring review. What I want you to know is this is a virtual review, but we've been notified. We've been notified that we will have the review. We don't have a date. We got the first notification that says City of Chicago will have a Focus Area 1 monitoring review. The second communication will be a letter letting us know who the lead of that review will be, and it will give us 45-day notice as far as when the review will start. And so this will be a virtual review. They will be requiring us to scan documents into them for review. A team of individuals will be together where we will be responding to questions regarding our programmatic structure and everything else from soup to nuts. But again, this is a virtual review. Based on what it is that they're requiring, we may have delegates present at that interview. We anticipate that it will be about a week-long review because of our size and capacity. But again, once we know more, we will be coming back to you with that date. But in the interim, what I do want you to know is that it's going to cover all areas of the Head Start performance. The FA1 goes all the way through. It looks at program structure. It looks at ERCA. It looks at governance. It looks at fiscal. Looks at all of those different component areas and making sure that we are in compliance. And of course, as you know, for the city of Chicago, how we are in compliant here at the city, but also all the way through all of our delegates and all of your partners, that we can see a system. This is about looking at systems. This is about how all of these things align across every one of our programs and every one of our models. As I said in that first bullet up there is early Head Start. Head Start is also a part of it, our base grant, our early Head Start CCP grant, as well as our early Head Start expansion, which is our newest grant. And I know it's new, but it is still going to be a part of Focus Area 1. So again, one of the things that we did when we did the Focus Area 2 is we set up different meetings and we set up trainings. We are still in COVID, so we will be setting up a series of webinars to discuss the process, to stay in touch with all of you, to talk you through, to make sure you know what all of this is, what kinds of things we will be looking for. When we're having those webinars, we need your key agency leadership. We need program and fiscal staff. They will be required to attend these meetings because information that we will need it immediately. We will need it in certain formats, and we will be letting you know exactly what it is that we will be doing going forward in our planning here at DFSS. And so if there's documents that we need to get from you, you will know what needs to be scanned over and what time period, all of that information will be shared. And so just continue to mind your emails and know that we will be back in touch with you. And again, let me just specifically say this is federal. This is for Head Start funded agencies, but we have received our first notification that we will be having a Focused Area 1. The teams will not be on the ground in Chicago as they have for reviews previously. This is virtual, but it will be for about a week. Once we get notification, again, we'll be coming back to you. We'll be setting up webinars and they will be specific to Focus Area 1, and we need the key personnel at those webinars for those dates that we will give you. So more information to come, but know that we have gotten notification and we've started our discussions internal here at the city, and we will be flowing information out to you regarding Focused Area 1. One of the things that you all know is you can go onto eClick and the Align monitoring tool. There is a tour. If you want to go through the tour, you are welcome to go through the tour and understand what the monitoring is. But the FA1 or Focus Area 1 monitoring tool is on eClick. And along with that is a COVID-19 addendum. My recommendation to all of you, and I know we sent some information or we'll be sending you links to that, but go on to eClick, pull down those tools and begin your review. It will give you more insights into what kinds of questions, what kinds of documents, and all of the information that you'll need. But again, remember, we're going to support you through it as we support ourselves, so more information to come. And we're going to have questions and answers toward the end, so just know that we'll come back to that. Next slide. So I do want to give you an enrollment update, and I thank you. I can see, and I've been monitoring COPA a couple of times a day, and I can see that the numbers are definitely increasing. So I thank you for what you're doing as far as getting your families enrolled. But I do want to draw to your attention that we are still under enrolled across all of our funding streams, and I do need to draw your attention to that. Again, I thank you first for all you're doing, but I do need everyone to continue your efforts in recruiting and enrolling families. We need to make sure that we get our numbers up. I highlighted the Head Start number, and I highlighted it for this reason. What we put into our grant application was $7,404 for Head Start, but our grantee has been holding us to, the funder has been holding us to $9,274. And so the number that we actually allocated out to delegates was the $7,404, but every time we record, because of what they're holding us to, we have to use that number as our gatekeeper when we're thinking about how far away from the mark we are. For that reason, that's what's in front of you. Across, the next one is Early Head Start, funded for 2100 or 2162. We're at 1471. For our EHSCCP, 1100 is what we're funded for, and we have to date, and I did this just before this meeting, we had 681 EHSCCP children enrolled. Then for our expansion grant, our newest grant, the goals is 200, and we have 118. So that number has really increased over the last few days, so I thank you for that one. Our PI center base is 3,100, and we're 1,753, way down. So we've got a lot of work to do. PI home base, 1,658, 1,366 is the enrollment. And then PFA, 5,935, 4,013 is what's currently enrolled. And I want to talk to you about PFA, aligning back to what Tiffany talked about with ISBE and the IEIN numbers. We've all known what the qualifications are for a teacher in our PFA classroom. For years, it was a teacher with a bachelor's or master's degree with a professional educator license. A couple of years ago, we got a little bit of a flexibility that allowed us to have a teacher with a BA who also had to have a level 5 ECE credential through Gateways. That individual also needed to be in program working towards the attainment of their professional educator license. That person also needs to go into the system, registering themselves in the State Board of Education, where they will then be able to get what's called an IEIN number. In order for the classrooms to count, those teachers have to be in that system, they have to have the right credentials, and we have to have that number, or that classroom is discounted. We can't continue to have classrooms discounted as we're moving forward with our PFA program. And so we have to get teachers into those classrooms, number one, that are qualified, number two, that are in the system, and number three, that number needs to be reported so that we have it here. I know our teams have been working with our delegates. I know Tiffany has put out a lot of information. We've done screenshots on how to get into the system to get that IEIN number, but we can't stop here. We've got to continue to do it. We've got to make sure that we get this done, that we get the right people in program. I know it's difficult out there, people. I know we're in COVID-19, and I understand all of that. And I know we are doing everything we can, all of us, and working with you, and we'll continue to do so. But there are some requirements that we cannot bend and we cannot flex, and this is one of those. And so I'm making a big issue about that because I know a few months ago we were talking about the IEIN number when we were reporting before. And when we're back talking about IEIN numbers again. So I just need to emphasize the point of how important it is that we get these in. If you have any questions or you need assistance, as always, we're here and we can talk about it. I put in our average enrollment year over year. I didn't pull that off the slide. It was there before. I want to show you, we've gotten here before. We've gotten to 100%. I also know that we were not in COVID-19. And that's why I left it there, because I wanted to say that to all of you. And I understand what you're going through. But I want to remind you all that you have the opportunity to serve children both center-based and remote. They both are countable. We've updated COPA so that you can actually show attendance for both of those, so that we are able to capture all of those children across all of these component areas. And we need everybody to push. We'll do everything that we can. We've got Kofi, for example. We've got collaborative partners out in community. And we got a team of people who's out recruiting behind the scenes and trying to help. We just need you to keep moving your families from wait lists into enrollment. We need you to be working your family's support staff in contact with parents, making sure that you are able to say to them that you're doing everything in program, that there's two options, center-based and home-based, or excuse me, center-based and remote. But again, we just need to get enrolled. And so I just need to give you that message again and just ask you to push and push for enrollment. And again, there'll be questions and answers as we finish with this. So thank you. Next slide.
All right, so I think this is a great segue into recruitment efforts. And I really wanted to talk to you guys about what you're doing and the efforts that you're making during this pandemic. We understand that this is difficult. We understand that it's not as easy as it was prior to COVID-19. However, one of the questions I want you guys to think about is, has there been a shift in your recruitment efforts pre-COVID-19 to now? What are you doing differently in your program? I think that's an important question. Feel free to go ahead and type in the chat. Be interested in kind of hearing what shifts you've made in terms of recruitment. The other thing is, has remote learning and teaching, right? Has that been effective for your staff and your families? What I want to be able to do as we are rolling out these every Friday CSD spotlights, I want to focus on recruitment. And I want to give it the time and attention that it deserves, because I've heard from some of you, and I know that some of you are doing some remarkable things that are worth telling the story. So please make sure that you send me any information that you have on recruitment efforts and your focus on recruitment as you're trying to get more families enrolled in your programs. That's going to be important. I want to highlight those things. The other thing is, we learn from each other. And so if there's, special grassroots efforts that you guys are doing, if there's family referrals, social media, community partnerships that you're working through, I want to be able to tell that story, and I want everybody to go ahead and take a look at the awesome job that you're doing. So help us help you. And we really are interested in hearing about those recruitment efforts during the pandemic. Thank you.
Next slide. So before she does attendance policy, I just wanted to say one of the things that I am going to be sending out, working on a draft right now, where you will be asking your family support staff or other staff to be reaching out to parents, again, and helping you with recruitment, which is what we're talking about. If you've got families that are stuck on the wait list, you've been trying to communicate with them, trying to get them to enroll. We want to find out what the barriers are. Why are parents not moving forward in their enrollment? You may have had parents that you've gone through and you've done everything, but they're not showing up. We want to know why. And so we're going to send out to you a document, which is a script on some of the questions that we're asking you to ask of your parents. And then sending that information, it will come back to us in the form of a survey so that we can find out really what is causing parents to not enroll in programs right now. I think we all have some ideas about it, but we want to put our fingers on some of their responses and understand a little bit better. So you will be receiving that document, which will align with what we're talking about as far as recruitment and enrolling. And it will be our ask of you is to have your staff follow through and find out more from parents about the why not. Why are they not enrolled? Why are they not following through? I'll turn it back over to Tiffany.
Thank you, Rachel. So in terms of attendance policy, this is really repeat information, but I think that this is worth mentioning again, because we've made some enhancements to our data system, the COPA system, to be able to speak to the needs during the pandemic. And so one of the things that we're saying is we expect for attendance to be taken in COPA and updated on a daily basis. So the attendance module itself has been updated. One of the things we were trying to make sure that we captured for our funders and also for you is that remote attendance piece. As you know, we already had attendance in there. If you're attended, you're attended. Now we have what we call RA, remote attendance. And so the feature has been added to document remote attendance. And we want to make sure that, if you're teaching, to the children when they're at home or outside of your presence, right? If you're teaching to them, we want to make sure that you're checking the right box. So the regular attendance feature is for a child who actually comes in person, but the remote attendance, which is denoted by RA, is for that child who is outside of your center. The other neat feature that we added under the attendance module would be the temperature checks. So the daily temperature checks for children, they can be logged in our system now when you're recording the attendance for the day. Temperature checks is something that if you're not doing it in COPA on a daily basis, you can't go back to yesterday or a week ago and go ahead and check a temperature. Okay, you can only do it the same day as the child would attend. And that's important because we want to know that you're getting real-time information. We want to know that it's being entered into the system. We don't want to give you the opportunity to go back and remember the temperature a week ago, okay? So temperature checks can only be done same day. The weekly attendance feature, something that's been updated under there, really is to promote the remote learning, right? So if you're going to go ahead and do a weekly attendance to try and catch up, you can't do the meal count, right? Because again, they're remote learning, they're at home. And so the idea is that we don't want you to go ahead and count those meal services for remote children. And also the temperature feature. Again, it won't be allowed if you're trying to go back and do any attendance corrections or modifications for a week, because you can only do temperature features on the same day. So they're very important. Thank you. Next slide. Non-federal match and remote learning. Wanted to make sure that we brought this back to you just in case anybody missed it, because we've been getting this question quite a bit. And I know we talked about it during our last meeting, but can parents' time during remote learning be counted as non-federal match? And the answer is yes, they can. We just want to make sure that any non-federal match that you have, that you're following your guidelines to make sure that it is verifiable in your records, to make sure that it's allowable under uniform guidance, to make sure that it's necessary and reasonable. We know that it's necessary and reasonable. I mean, we have parents who are really working hard to help us make this thing happen. And so we want to make sure that we're valuing their time as appropriate. Again, make sure that it's in your records, which means that it has to be in your contract budget. It has to be reviewed and approved by DFSS as well. But yes, overall, non-federal match for parents' time during remote learning is absolutely allowable. Thank you.
Next slide. So I want to give you a fiscal update. And again, some of you have already been made aware of this, but again, because of the urgency behind it, I did want to include it in today's webinar. One of the things I just need everybody to know that the staff here in CSD and both our fiscal staff, they're reviewing and tracking agency utilization. They're doing it across all of our funding streams and communicating concerns. They're communicating with delegates to say, hey, you haven't vouchered. Hey, you are, underexpended. You've only expended X dollars in your grant, and reminding you that the dates are coming up. For example, our Head Start funding year ends November 30th, and there are people, when I looked at some of it, were 30% expended. There's a lot of money that's still out there. We don't want to leave money on the table. We don't want you to leave money on the table. We want to make sure that we're able to utilize our grants fully. In order to do that, people need to be vouchering. With that said, our funders are asking us to have individual agencies, those of you on this call, across all of our funding streams, to be vouchering in timely, sending in invoices. And so I'm saying here monthly. If you are not able to do monthly, you will need to have conversations with Tiffany here in our office, and also maybe with your fiscal contact, because what they're asking us to do is to be able to show our utilization across our grants so that they can see whether or not there's underspend. They can see whether or not they need to reallocate money on their side. And so this is a push. This is a push I know on many of you, but we need individual agencies, all of you, to be vouchering more consistently than you do. I looked at some of the reports, and there were a few agencies, I'm not going to put anybody's name out there, who hadn't turned in a voucher in 6 months. Obviously, you're fluid, and that's great, but what you're putting yourself into is a possibility of them looking at this being underspend and them wanting to reallocate dollars. That's not what we want for any of you. So we do need you to make sure that you are working with your fiscal staff, whomever is responsible, your budget team, whomever is working with you, that they're preparing and submitting vouchers more often. Know that in the iSupplier system, you can voucher as often as you need to. There's nothing in that system that says you have to do it monthly, quarterly, none of that. You can go in every time you make a payroll, so you could do it twice a month if you so choose. That system is allowed, and you can do that so that you're in there, your dollars are showing up in reports as being expended. I am asking everyone to do that. I do know that there were 2 fiscal trainings. There was one on October 8th and October 9th to go over invoicing and iSupplier system. They are working to make sure that that recorded training can be made available to you. So we'll make sure as soon as it's available. As always, we put things in our CSD update. You will get it. Look in the update. We'll make sure it goes out. But please, this is one that we need you to adhere to. We need you to be vouchering more consistently than you do. We need you to use the iSupplier system the way it was intended. Like I said, you can go in every time you make a payroll, you can go in and voucher. You don't have to wait for a month to do 2 payrolls if you're doing it. If you're doing a payroll every week, you don't have to wait the entire month. that system will allow you to go in as often as you need to. And we need people to be doing it much more often than you do. What we're finding is we're getting down to the wire on our grants, and we see large numbers of dollars that are still out there. That's not to say that you're not going to come up with a whole lot of vouchers at the end of the day, but that's not what they want us to do. What they're asking is to be able to do this across time. The reason that I'm really pushing, and I'm saying this to you, is because I'm asking my staff to then work with you and the fiscal staff to help you do budget revisions. And you won't be able to do a timely budget revision if you need to move dollars if you're not vouchering, because we can't see what's under expended. We can't see a good picture of what's going on, and we can't help you in that process. So again, we just need people to change, and some of you are vouchering. This is not a message for everybody, but for those of you who are not, we need you to get into a different pattern of how you're vouchering the city of Chicago for your services that you're providing. We don't want to see anybody's dollars reallocated due to underspend and underutilization. And that's the direction that we're moving towards. And we don't want to go there. We don't want you losing dollars. One of the things that we are definitely aware of, the children don't leave because dollars are reallocated. You're serving families. We need the dollars in your hands so you can consistently serve them and be able to do for them and yourselves the services that you need to have in your house. So please listen if you have questions on the system. Nicole Roberts, who actually did the training, is in our fiscal office here, DFSS, and her email address is there for you to reach out to her if you have questions. You can always reach out to Tiffany if you have questions as well. But Nicole has been the one who's been doing the trainings out of the fiscal team and is ready and available to respond if you have questions. Next slide. So see some of the updates that we want to give you. Again, everybody, just like we are, and I've been on the system today a couple of times, looking to see if the FOA for the Head Start grant, meaning that the competitive grant application, it was not there. And so what we're saying to you is, reminder how we got here. It was due to safety violations. But again, we do know that we have been waiting. It was due to be released on October 7th. We are at October 22nd, and it still hasn't come up on the system. We don't know. We don't have any back, knowledge. And because we're the current grantee, we don't have any knowledge about the why behind it. But we do know that it hasn't been published, and we're still waiting, just like you. What we do know from the information that we were given is when they do publish it, it will be 60 days, meaning open for 60 days from the posting of it to the day that everything needs to be submitted. So somewhere in there is when everybody will be writing. We know that everybody is waiting to see it. We are, as well as you. I sent out an email recently to all of our Head Start funded agencies, just reminding everyone that we are reaching out. We've had quite a few meetings with delegates, and we'll continue to do so. And we're in contact again. And part of the whole message is thank you. We thank you for having been our partners. We also want to remind people that this is competitive, and we understand that all of you have some decisions to make. You are leaders of your organizations and need to be making the best decision for your organization going forward. And we also understand that this is competitive and other people are planning to apply, which means that there's conversations going on in community. Again, if we have not had a meeting with you and you have not been scheduled, we are trying to get them all scheduled. I do know we have some more coming up tomorrow and next week. So we're continuing to schedule meetings to have one-on-ones with our delegates. We do have one group meeting that we're going to do. It's already scheduled. And if you have not responded yes to that, if you are receiving that information in that email, please do so. My last ask on this is if you get an email that comes out from Jocelyn, who's my assistant, please respond. She's trying to work with my calendar. She's trying to work with your calendar to try to get these meetings scheduled. Again, if you don't have one scheduled yet, we're still working on it. If you want to send an email and say, hey, where's my meeting? Just go ahead. You can send it to me. I'll make sure she gets it. We're trying to schedule as many as we can in the span of a day across all the other meetings that we're doing as well. But we're still meeting with people. We have not stopped. We'll continue until we've been able to touch base with each and every one of you. So again, thank you. Again, we know why we're here. We're waiting just like you to see that competitive application open. And we do plan to submit a competitive application once it's open. That is the City of Chicago's plan So we're waiting just like you. And as soon as it opens, we're going to have to go silent because it is competitive, everyone. Just know that we will be doing everything that we can, and you will be doing everything that you can. Either you're writing, partnering with someone, or even partnering, continuing to partner with us. We do know that there's a lot of thought and a lot of consideration that's going on out in the CBO community right now, and it is understood by us, and we respect it. So thank you. Next slide. So a couple of things I want to go back to before we get into questions and answers. I want to update you on a couple of things. Number one, could you go back to the slide with the agenda, Tom, the second slide? So update on reopening childcare, and I held this to the end because we've got all of our sites open except for a couple that are going through with some licensing issues right now, and they've not been able to open, but we've opened all of our other programs that we anticipated that would be opening. With that said, we know as of today, and there was an announcement, and there was a press conference earlier today regarding COVID-19 in the city of Chicago. And I'm sure some people have heard it and did listen. We're going in the wrong direction, people, as far as COVID-19 across Chicago. And so the mayor has made her announcement. Dr. Arwady was there and others talking about the direction that we're going. Right now, no decisions about doing anything different with childcare was announced in that meeting. And so we are still programming, we're still operating, we're still serving families. We are looking back at data again regarding the cases that we're getting, and a report is coming out. I did do a preliminary, but we have more data now to look back at what's been going on in our programs regarding COVID-19. But again, it is concerning to all of us in the city of Chicago, in our state. Where we're headed right now with COVID-19 is extremely concerning. And I wanted to come back to a message point, and that is, in your programs, stay the course, continue to do what you've been doing, stopping people at the door, like Tiffany mentioned, taking that temperature, making sure that you know about the individual who's coming in, making sure that your staff understand if they're not feeling well, that they should not be in your program facility, that parents need to understand if they've got a sick child, that they need to keep that sick child at home. On top of this, we're also emerging into flu season. In our CSD update, we gave you information about making sure that your families are getting the flu shot. Our children need to have a flu shot. We need our families protected. Again, these are personal decisions that our parents and families will make, but we do have to encourage them to do this. We know that, having both of these right now will be very, very difficult in our community. So everything that we can do to protect ourselves is what we're asking everyone to do. We want to remain open. We want to remain that service partner to our families and for our children. But in order for us to continue to do that, we have some work that we have to do, and we need to stay the course. That enhanced cleaning that you're doing, making sure, again, that your groups are staying together, that you're not crossing individual children and or staff across the day, mitigating risk, doing everything that you can do. Right now, hearing that the numbers are going up, I just need the vigilance on your side to be there across all of your programs. Thanking you for everything that you're already doing, and I know how hard this is out there for you. Just on this side, just hearing, knowing what I'm talking about, not just within our own cohort of delegates, but with other people across Chicago. We understand that this is hard. We understand your job is not easy by any stretch of the imagination, but safety has to be the way that we operate and what we have to do as far as our number one priority for ourselves, for our children, and for our families. And so again, vigilance on your side. Please just keep it up. You've been doing it. Just continue to do it. It's all we can continue to ask all of you to do is don't give up. Continue. Don't let any of your staff let their guard down. We've got to continue to do what we're doing. Along with childcare and opening, we do know that we have another 12,000 masks, children masks here, and we will be sending out announcement on, again, like we did before. We will be packaging them for the delegates and then giving you a date to come and pick them up. Again, we've got another resource that we want to give out for all of you.
In addition to the child-sized masks, we are ordering PPE. We understand that you guys are going through PPE like crazy. And we don't want people, as Saratho had mentioned, we don't want anybody to feel like they have to take shortcuts and skimp on things. And so if we can be that resource, we definitely want to be that resource. As soon as our PPE shipment comes in, we will definitely be contacting you. That way you guys can come and you can make arrangements for a pickup. We want to make sure that you're staying safe. We want to make sure that your health and safety practices are at an all-time high, and we're going to assist you in doing that.
Thanks, Tiffany. So one other thing that's on the agenda, which we haven't gotten to, is Every Child Ready Chicago. And so many of you have heard about Every Child Ready Chicago. I just want to make sure that if you haven't heard, that we brought it to your attention. And by the way, Jennifer Alexander from the mayor's office, the policy staff person, is on the call as well. So if there's some questions, she can chime in. But I'm just going to give you a high level piece about what all of this is. This is visioning work. And so Every Child Ready Chicago it's a public and private partnership. It's being led by the mayor's office. It's in partnership with Start Early, formerly known as the OUNCE. But individuals that are on that steering committee includes the mayor's office, of course, individuals from Start Early. Lisa Morrison Butler, our commissioner, is on that group as well. And there's also work groups. And so Tiffany and I are working on work groups, and it's across the city that we're working. There's Chief McDade from CPS is also a part of this. And this is looking at the vision from prenatal to 5, looking across the board and trying to see, what kind of vision would we have that would be cohesive across a system as large as ours, that provides equitable access to supports and services to ensure the highest outcomes for all of our children. What we want is the best we can possibly do for our youngest learners that are out there and their families. And so this is work that has just started. This is going to be work that's going to happen over a multi-year process. It is a collective effort. There are individuals that are on it. There's parents that's on this commission, on this committee, and there's also other staff members. And so in the working group that comprises a lot of different representatives as well. But just wanted you to know that this is moving forward. This is one of the things that everybody's, what's the vision? Well, this is some of the work that's being done from the mayor's office about the vision. And this vision is from prenatal to 5. I just wanted to be able to say that. And so if there are any questions, Jennifer's on the call. So if there's any questions about Every Child Ready, if anybody wants to put those in the chat box, we'll be able to see those and we will be able to respond. And so I'm going to go ahead and say, Tom, let's look at what's in the chat box as far as questions. Thank you.
Yes, I'm here. Let's see, on your end, if you'd like to pull that out from the pane, Saratho and Tiffany,
Got it.
There were a few questions I addressed earlier about people that were having technical issues with hearing, but those were resolved, and everyone was able to watch the webinar and see and listen today. And I think the questions start. Did you? They start with the temperature check.
I'm not seeing them, so I'm going to have you assist with that. It's not opening all the way for me.
Oh, okay. There's if you want, while I do the first one, there's on the questions pane, there's a little square with an arrow pointing to the left that will pop it out just in case. I'll look at that.
And
one
so
of the first questions.
Okay, I do see one question. Yeah, I do see one question. I'm going to read that while I'm still working on the pane, Tom. But it's how do we document non-federal plan if we can't collect signatures from remote learning families?
Yes, that is one of the questions.
And so when you're looking at what you have for your remote learning families, when you're looking at what you have as far as documentation, you got attendance, because we fixed the portal so you're able to do that. You should be doing Zoom. You should be doing other activities that you're doing. All of the documentation that you have becomes a part of your plan. Again, what's your approach, what's your plan, and then your documentation of it actually happening becomes a part of how you will be able to document. Yes, you are not going to have signatures for every parent, but collecting that in your remote attendance. That's why it's in there, so that we can pull those records. You can pull those records, and we can see that data that will help support you in this process. Again, your documentation from what teachers, who's the staff member, family support, case notes, everything that you have becomes a part of your picture and a part of your plan and a part of your documentation.
Absolutely. And, you know, Sarito had mentioned the platforms that you're using, whether it's Zoom, whether it's GoToMeetings, or any other platform. There should be a report that you can print to show who the attendees actually were and how long the attendees were attending. So there's documentation on your side that you should be able to pull together in order to document those efforts.
All right, Tom, is there any way for you to pull it into the screen? Because it's opening up, but only that question.
Sorry about that. I was on
I've
mute.
got it.
Oh.
I've got it.
Oh, you do have it up to, if you go to
Yeah, I got it. I can
332.
I've got it.
332. Okay, you're welcome.
Yeah. So what Gwen is saying, only staff with PEL would have an IEIN, correct. No, that's not correct. A teaching staff who has a bachelor's degree and also has their BA level 5 credential, who is going into the ISBE system and documenting that they have both of those and can document this with credential and with degree, and that they are going on a pathway towards getting their Pell, can get an IEIN number. Okay. If you have, I hope that answered your question, Gwen, but yes, not just those with the Pell. They changed the system when they gave the waiver, allowing individuals to be in classrooms with a BA level 5. Our temperature checks in COPA required if we keep our own logs. As we said in one of the other meetings, it's not required that you put them in both places. What we've tried to do is make it easy for you, in that if you're doing attendance in COPA, that you can also put the temperature check in there. We do understand that people have multiple systems that they already had at play. So I'm not going to say to you, Emnet, that you have to use it, but it is there and available for you so that you can track those temperature checks. What effective date was the remote access feature implemented as a live option?
It was implemented in August, so prior to rollover.
And we wanted, when we started this new program year, for that to be an option. We mentioned it in September, and we're coming back to you again, making sure that everybody knows it's there and it is open. Tracy is, if the person has the Gateway Level 5 and they register for the IEIN number, do we put the drop down as Pell 04, even if they still have not gotten their license yet? I would not want you to put it into COPA as a Pell, because it is not a Pell at this point. I'm looking at Tiffany, we're in the same room. But we do need the IEIN number given to staff here, so that goes into our report. We have a separate report where we're putting the IEIN numbers. Once that person has a Pell, of course, then you'll be able to do that drop down box. Again, we're still working with COPA. We may, I'm not going to overpromise and say that we're going to get IEIN number in there. We've got Pell, so right now, just make sure you give it to your team here so that they can put it into our report that we're sending to CPS for ISBE.
Yeah. And Tracy, if you run into any challenges with that, just give me a call, send me an email.
So Will is saying he needs help in getting budget approved, budget revisions approved quickly.
Yep, contact Tiffany Jenkins.
All right. We'll just get in touch with Tiffany and she'll talk with you about your need for your budget revision. Relative to under enrollment, this is from Scott. Could help diminish the PI center-based problem as we have children eligible for those slots. Is DFSS prepared to release those slots? And if so, should we submit a PICB center-based slot allocation immediately? If you have not done a slot allocation, reallocation, you can go ahead, Scott, if you've got children that are eligible and you think you have in community children that are eligible for PI center-based, know that we are not able to recontract at this point. which is one of our little sticky pieces that we have right now. But let's talk offline, Scott, about what it is that you think you have as far as children, so that I can better understand what you have as far as their eligibility. So Scott, if you don't mind, if you can get in touch with me so we can talk through that.
And I just want everyone to know, so the 3,100 center-based PI slots that was referenced on that enrollment data that we looked at earlier, all of those are contracted out into delegates' hands. I need to make sure that folks are enrolling. And, you know, if you're not enrolling, then that's going to be a separate conversation. This is a pandemic, and I think that, you know, the flexibility that we've offered through this is probably going to be as flexible as we can ever be. But make no mistake about it, you know, once things go ahead and go back to normal, we will have to be working with our programs to ensure that we are meeting our funder requirements.
Thanks, Tiffany. And so there's a question about mental health and working in programs. I do know that we gave some information, but what we'll do is put out more information. And again, with the guidelines really is about individuals coming into your program. I know many of the mental health providers have been doing virtuals and working with children and families specifically and staff. So I will, if you can send me an email asking a little bit more specific about your questions. And I understand there's so much loss, there's so much going on. There are children and families that are just suffering out there. And mental health supports are needed across the board. One of the things that we did add to our CSD update is mental health, because we wanted to give you some supports as well that you can use in your programs. But we are going to be working with our mental health provider and regional mental health providers as well to see what else we can do in getting supports. But I do know we sent some information out. We will be sending out some other information as well. And I do agree, reducing some of the anxiety and fears of children and families will increase our recruitment efforts. And I know that there's been a public campaign in the city of Chicago about mental health support. So one place that I'm going to direct you to as well is the City of Chicago website, because there's some resources there for mental health support as well. So I want to just wrap everything around and make sure that we have everything that we can access in support of our children and families. So again, DFSS will send out some other information. We're pulling in our mental health person along with the regional mental health team, but also the City of Chicago website has some very valued resources where parents and individuals can literally make phone calls and get supports. But in addition to that, we're asking that we continue to work together to try to figure out what else we need. And for that, I'm going to ask if you can send me an email, Rachel Burgess Burnett at cityofchicago.org if you don't have it. If you do and need it, I can put it in the chat box so that you have it, so that you can reach out to me and give me a little bit more if you have some things that you're experiencing that you need, anything in addition to what it is that we're doing to make sure that we're supporting you through this. This is a real critical time for all of us right now, and we definitely need to wrap our hands around our families as much as we possibly can. So thanks for the question. Know that we are here, we're supporting, and we're looking for additional supports, but also check the CSD updates, because we've been trying to put some supports around mental health in there as well. We do not as a city have DFSS, let me put it that way. No, we do not have free Wi-Fi for families, but one of the things that we did, if it's a federally funded program, one of the things that we did say when we were talking about the CARES dollars, we were encouraging agencies to figure out ways to do Wi-Fi for families, because we understand that that's one of the pieces that's a stopgap measure. I'm saying do it, but you don't have access. That's a problem, and we get it. And so we don't have the ability from the city to make sure that all of our families have access. I know the City of Chicago is thinking about ways to do some of that. But one of the things I would do is check back and see, have you, if you're federally funded, there's dollars in CARES that would allow you to think about how to get Wi-Fi for your families, meaning Wi-Fi hotspots, those kinds of things to support them was included in the opportunity to use your CARES dollars. The RA means remote attendance, and that's what that RA is. That's in COPA. That's where we're talking about. You can select that for children and families that you're working with remote. Is that RA? It's so remote attendance. one of the low enrollment problems that the parents became unemployed and ineligible for child care assistance. Yes. This is a phenomenon across the state. This is not just at your program, Sano. This is across the state of Illinois, across our nation, period. Parents are losing their jobs. And the CCAP program does still require employment. And so we're lifting that up as one of our concerns. And one of the things that we're seeing, is there something that we can do about that? Because again, we know that families have lost their jobs. If they're not working and don't have access to payroll information, a letter from an employer, it renders them ineligible for CCAP. But I will say, Sanho, one of the things that was also available at the state level were grants to support loss of CCAP. Doesn't cover everything. If you have questions about that, if you haven't been able to apply for it, please send me an email so that I can get that information out there to you, because I would, we want everybody to access every dollar that helps you through this crisis. Am I currently requiring centers to be open in one one system or another, meaning either center-based or remote? And I have some that we're considering open, but what they're able to do because they're in a school program, they're doing remote learning. We need to be in contact with our families. And Cindy, it looks like you've left the meeting. I'm going to send you an email as a follow-up, because remote services are being offered, as you're saying, and you can continue to voucher if you're doing the remote, if you're capturing that attendance in the system, if you're doing all of those things, then you're still serving children. We understand some facilities are not open, but the remote learning still should be continuing as you've described in that question. So yes, you are still you're able to be funded because you're still serving children and families. As far as submission extension, Scott, I don't have an answer for you yet. As far as CARES Act dollars, that's something we're going to have to come back to you. Again, I understand what the concerns are. It's the amount of money that people are receiving, the timing that you're receiving it, and trying to expend all of those funds. We understand that there's some complications there. We're trying to get more information, and we'll come back to you as soon as we get an update. And we understand your concern.
And I just want to make sure that everybody knows that the CARES dollars, according to the contracts that you receive, I'm sure you've seen this, but March through November is the time period that we're talking about. Okay, so I want to make sure that everybody's clear on those expenses and what's going to be allowable then to that contract.
Jennifer, there is a question that's in the chat box. It is from Mario. I'm going to read it out loud, and if you can respond, I can open up your mic or have Tom open up your mic. The question is, at this moment in time, there are multiple strategic planning processes occurring in parallel. For example, Every Child Ready Chicago, the Governor's Office of Early Childhood Funding Commission, and the Ounce of Prevention's Prenatal to 3 initiative. Is the Every Child Ready Chicago working in collaboration with the other strategic planning movements so as to avoid working at cross purposes? And then lastly, how will Every Child Ready Chicago ensure transparency and broad input for the early learning community that was lacking during the UPK process?
Hi, so Rachel, can you guys hear me?
Yes, I can hear you. Thank you, Jennifer.
No worries. Thank you, and hey, friends. So the response to the first part of your question is yes. And then as it relates to transparency and the process for how we're going to communicate to our broader group of stakeholders, we're still figuring that out. There are some questions about whether this will be under the Opening Meetings Act. That has not quite been figured out. There are members, and then Mario, to circle back to the question about representation, there are members from this body of delegates and as Sareto indicated, we also have a vast membership, as you all saw from the working group list. And our intent is to focus on early learning for the entire ecosystem, birth to 5. So we're not just looking at UPK, and we're not just focusing on CBOs and our Head Start and Early Head Start program. So we want to, be very explicit in saying that. But yeah, I think that answers your question without going too far down the rabbit hole.
Thanks, Jennifer. Mnet, the question is, are reimbursements for services solely based on number of children enrolled, or is Office of Head Start still reimbursing at 100%? My reminder to everyone is the flexibility that we had for federal dollar ended at the end of September. That's why we're pushing for enrollment right now, so that we don't have to start looking at reducing funding to all of you. Right now, we are reporting to them, and they are seeing that we are not fully enrolled, but what they're also seeing is an uptick in enrollment. So they're seeing that we're moving in that direction. Head Start is also recognizing nationally that there's under enrollment. We're not the only city that's going through this, but we have to constantly show that we're moving in the direction of trying to get as close to that enrollment as we possibly can, either center-based, and that's why they're still allowing us to do remote learning. They understand the needs here. And so, Emna, to your question, we are still reimbursing based on the children that you have enrolled. We've not cut your grants. And let me just say this, until I get something from our funder that says I can no longer do it, we're going to continue to work towards enrollment. We're going to continue to fight the good fight. I'm asking everybody to continue to do everything that you're doing. Tiffany's talked about some things. We're going to be sending some scripts out there for you to get in touch with families. My ask of you is that enroll center-based, enroll remote, enroll every family. Don't let families sit on your wait list. They're concerned already. They need to be supported. They need to be served. And if they're sitting on wait lists, they think that we're not interested in them. And we don't want families feeling that way at all. And so what I'm asking is that you continue to enroll. If you need any additional supports, reach out to DFSS, let us know. As I mentioned earlier, we've got people out in community that's also trying to help with recruitment. But again, if you're not fully enrolled and we continue down the same path, we will be having a different discussion. Let me say this, Emnet, we're not there yet.
Absolutely. And I think I wanted to add on that and say, enrollment is important, but what about the services that you provide then to that family and that child after you've enrolled them? That's going to be important too, to be able to tell our story about how we can continue to fund our programs. You can enroll a child and then the child never actually attends the program, whether it's remote or in person. And we don't want that to happen. So we want you to make sure that there's going to be a focus on what services are we providing this family? Not just that, how am I documenting that? Because that's going to tell the story.
So Betty Diaz has the last question, and that is for agencies with early Head Start mental health funds. When can the agencies anticipate receiving notice of funding? When you say, I need you to help me, Betty, when you say early Head Start and then you say MH, I'm going to assume that that was mental health, and I'm going to make the last assumption that you're talking about your quality dollars. It's not clear. If you can clarify that question for me, Betty, I can try to respond to you. If we get off of here, because we're going to need to end before, then we'll send you an email and try to get clarity of what your question is. I'm going to make the assumption again that agencies who have early Head Start, the mental health, I'm believing that you maybe in your quality dollars talked about doing some work with mental health with your dollars that you were receiving. Thank you. I was going to keep talking, hoping that you respond. Thanks, Betty. I know that the QI, COLA and QI contracts they're out there in the hands of our delegates, and so delegates need to be replying, getting all of your docs in a row, sending back in everything so that you can start using your dollars. But the contracts for COLA and quality have been awarded, and so if you have not and you need it, if you have a question, reach out to Tiffany. But those contracts have been awarded, and you are able to, once you get everything in and you're in the system, you can start accessing those dollars.
Absolutely. So COLA and QI, they're in your hands. We're looking to execute those contracts as quickly as possible. So they've been approved. So the things that you said you were going to do in those applications, we're looking to go ahead and make sure that comes to fruition. The CARES contracts are also in your hands. If there's any discrepancy, contract questions, make sure that you let me know.
You're saying support funds for okay.
Yeah. Betty, this is Tiffany. Just make sure that you contact me, and you and I, we can have a conversation offline.
Yes, please, Betty, just reach out so that you and Tiffany can clarify that. So with that said, I'm going to say thank you to everyone We've been on for about an hour and 10 minutes. And I know everybody's got a lot that they're doing. There's a couple of things that I want everyone to do. Number one, I want you to go and I want you to look on the website and I want you to listen to Mayor Lightfoot and Dr. Awadi's press conference, if you have not heard it, where they're talking about what's happening with COVID-19. I want you to be vigilant and stay the course and continue to do enhanced cleaning and everything that you can to support your families and keeping yourselves safe. And then the other one that I'm going to say, and then I'm going to let Tiffany have the last word, is I need everyone to expend your dollars. We don't want to end this contract year with dollars left out there. So please, Will, you're going to get in touch with Tiffany about your budget revision, but please make sure that you're doing everything that you can to expend your dollars. We understand that one of the things, the benefits of having Head Start dollars right now is you're receiving a lot of dollars at the same time. You've got COLA QI dollars, Equality Initiative dollars. You've got dollars for CARES that are out there to help you with the PPE, technology, other things that you need. And then you've got your baseline budget. So you've got a lot that you're minding right now, and we understand that. And if you have questions or need support, please don't hesitate to reach out. But we do want to make sure that we are able to expend the dollars that are in your hands in support of you and in support of your programs and in support of children and families. And with that, I'm going to turn it over to Tiffany to have the last word today.
And just really quick, as a reminder for our federally funded blended programs, I just wanted to make sure that folks understand that when you have a family who comes into your federally funded program and you're relying on blended funds, even if a parent loses their job, okay, and they are no longer eligible for childcare, they're still eligible for your federally funded program. And so we shouldn't be putting people out of the program because they can't meet the childcare funding source. Our EHS CCP does allow for loss in subsidy. And if anybody's not familiar with that, make sure that you contact me offline so we can talk about how we can kind of get you some support along that lines. But just want to be very, very clear, just because someone loses their job, if you're in one of our federally funded programs, even if it's blended, right, that they don't lose a spot in your program because of that. Thank you guys so much. We really appreciate your time today, your attention, your questions, your involvement, and be safe, be healthy.
Thanks, everyone. Like Tiffany says, stay healthy, be well, do everything that you can, stay vigilant, and we'll talk to you soon. Thanks, everyone.